I'm a spine surgeon. Here's how I choose my interbody fusions. Watch my previous video for a description of all 5 interbody fusions. The major variables are the levels I'm fusing, the patient's anatomy and their surgical history, and what the goals of surgery are. I'll go through all 5 interbody spacers here. ALIF, or anterior fusion. This is a great option, but the approach goes through the belly, so I have to coordinate with a general or vascular surgeon. It's an excellent option for L5-S1 because the vessels have usually bifurcated or split above that. It's a little more challenging at L4-5 and L3-4, but you can still do an ALIF there. It's a really challenging operation for obese patients or patients with previous belly surgery, and it can leave a noticeable scar. XLIF and OLIF. These are often the exact same cage, just placed at a slightly different angle. I like it a lot better than a TLIF. As you can tell, this is an XLIF here. This is a TLIF. The footprint is easily 4 or 5 times bigger. I can span the entire disc space. I don't need a vascular or general surgeon because I'm not going through the front. It gives me great decompression. It provides some scoliosis correction because I'm leveling out that disc space. 10 out of 10. My favorite interbody. PLIF and TLIF. This is a really small spacer. It's limited by the anatomy, so the nerves coming out of the spine and the nerves traveling down. I can only get it in that small triangle. And as you can tell, the footprint of this is nothing near what an XLIF or an OLIF would be. So again, that's a TLIF and that's an XLIF OLIF, similar to an ALIF. It's a really small footprint. It really doesn't support the vertebral bodies too well, and it ends up subsiding into the bone, as you can see here. Here's my algorithm. I use an XLIF at every level from L1 to L5, unless the patient's anatomy doesn't allow for it or they've had previous surgery there. At L5-S1, I use an ALIF if the blood vessels bifurcate high enough to allow me to fit a spacer there, and as an absolute last resort, I'll use a TLIF. In about 90% of my fusions, I'll use some sort of interbody fusion device. Auditing my cases, it's about 75% XLIF, 20% ALIF, and 5% TLIF.